Aloha, I am Christy Chadwick. I have a master's in deaf education from Washington University School of Medicine in St. Louis. During my program, I learned alongside audiologists to learn more about the science of the ear and also how devices work, such as hearing aids and cochlear implants. With this, I learned a method called listening and spoken language, or LSL. Now living in Hawaii, I run an organization called Hawaii Hears. My mission is to deliver services to families who have children diagnosed with hearing loss, who use hearing aids and cochlear implants. I also provide education and awareness to professionals in early intervention around language development for children who are deaf or hard of hearing. The main focus of Hawaii Hears is to provide support to families, to empower them and help them get what they need to be able to communicate with their child. In this series, we hear from audiologists, teachers of the deaf, parents of children who are deaf, and individuals who are deaf or hard of hearing. If you want to learn more about my services or what Hawaii Hears offers, please visit hawaiihears.com. You can also donate by clicking the donate button at hawaiihears.com. Mahalo. In this interview, we get to talk to an audiologist and a deaf educator who are a married couple. They live in California, just recently moved there from Mississippi, and they are also classmates of mine from Washington University School of Medicine in St. Louis. Kyle is a deaf educator who has worked in early intervention and now works at a preschool. And Kaitlyn is an audiologist who was on the PEDS track, the pediatrics track for audiology at WashU. And we actually got to take some courses together where she was learning more about the perspective as a deaf educator for listening and spoken language, which is pretty awesome to all collaborate and come together because this is a team idea, and this is what we get to focus on in this talk, where you'll learn more about that team approach and what it looks like to collaborate, and also learn more about the services that are happening around the mainland. Thank you so much for listening, and let me know if you have any questions, give below. And if you have any questions you'd like to email to me, you can reach me at info@hawaiihears.com. Thank you. All right. Hello and welcome, Kaitlyn and Kyle. Thank you so much for taking the time today to sit with me and talk about your experience as a deaf educator, teacher of the deaf, Kyle, you are, and an audiologist, Kaitlyn. I kind of want to start out with where you are right now. Like what's happening in your world? Where do you live? What's your experience? So Kaitlyn, go ahead and tell me a little bit about what you're doing.
Okay, well, thank you for the invitation for having us. My name's Kaitlyn Wenrich. I am an audiologist. We currently live in San Diego, and in my current position, I am working with audiologists and surgeons and training them on how to work with cochlear implants, providing professional education in California and in Hawaii. Previously, I was in the clinic as a pediatric audiologist and was also on faculty at a university. So I served on a pediatric audiology team, also worked in research, and also taught some classes at the university level. And I'm married to Kyle. I'm married to a deaf educator.
Cool. So Kyle, hello.
Hi, how are you? So I'm a deaf educator. Currently, I'm working in Vista, California. I am at an elementary school that is a site for a listening and spoken language program. So my original position it falls under the umbrella of what's called NICSE, the North Coastal Consortium for Special Education. And what this is it's DHH services that are provided for children that need them from all different kinds of districts. So the site that I'm currently at is a space that we have under Nixie, where you have a home base, that's our site. And I'm in a preschool classroom. I'm a preschool teacher for the deaf. And any children from we have 14 different districts that we pull kids from. So any children who need DHH services that are preschool age or anywhere through 5th grade come to our site school, because we have myself as a preschool teacher for the deaf. We have a 1st through 5th DHH person who pushes in and pulls out. And we also have an SLP on site. And we also have 2 audiologists and audiology technician on site that also travel between the 14 districts. So there's a lot of services in this small area that we pull kids from. So
wow, yeah. How many kids do you service? Do you have a
at our site?
idea?
There's only 18, which doesn't sound like much, and I'm sure there are more. But for now, we have 18 kiddos, and I know they're anticipating more as the years go on. But we have 18 kiddos.
Wow, so 18 kids with 2 audiologists, 2 deaf educators. Did you say?
Yes, 2
and
deaf
several
educators.
audiologists, or
Yeah.
several SLPs as well.
Yes.
Yes. Wow.
Mhm.
That's awesome.
But that's
really
not
Okay.
including like the itinerant caseload. There's itinerant teachers as well,
Sure.
and their caseload is up to around 60 from the 14 different districts.
Wow.
So they're out and about all the time, going into schools and servicing the needs of those kids.
And they probably service a range of ages from junior high
Yes.
and high school, even elementary school, I'm sure. And
Yes, and even our SLP at our school, she works with not only preschool, but she also travels out and goes to the high schools as well, and works with a lot of high school kids that are on her caseload too.
Wow. Yeah. That's pretty awesome, though. That's similar to what we knew of in St. Louis. Yeah, about the special school district, and they had the hub of special school district in 1 or 2 schools, and then they also had itinerants, and they had deaf educators in one spot, and SLPs in one spot, and audiologists coming and going, and they serviced the kids where they needed to be serviced, basically.
Right.
Yeah. So the background of how we all know each other, that Kaitlyn and I actually took a couple pediatric classes, because you were on the peds track for audiology at WashU. And then Kyle, you entered the program the year after I graduated, I believe.
Yes, I started in 2016.
Yeah. So that's awesome. Yeah. How do you feel that the education you received at WashU has prepared you for your career as a deaf educator and as an audiologist?
I kind of think back to, I immediately started thinking about my brother growing up with his hearing loss, and there were things that I noticed that you didn't really think too much about as a younger. He's an older brother. My brother is 4 years older than, or 5 years older than I am, and I didn't notice it until I got closer to adulthood that there were certain things that he struggled with, and after going through my training at WashU, it made me realize that they were a lot more serious. There were a lot more serious things going on than what I really noticed as his brother before I had any of this training. So I think my education at WashU has been fantastic. It's been such a well-rounded education, because they give you the educational aspect, but they also give you the technical aspects of hearing loss and the anatomy and all those things that are very important to know as well, because you're not only dealing with parents, you're dealing with other professionals, you're dealing with families, kids of those families. So it's very easy when you have the information that you need and you can give that information to the parents. I think it makes them feel a lot more comfortable.
Mm-hmm. Yeah, definitely. What about you, Kaitlyn?
I couldn't do my job without the education that I received at WashU. So I did my master's in clinical research at WashU, and then I also did my doctorate in audiology. And as you said, I was on the pediatric track, so I also got to take some courses in deaf education, which is really unique. Not many audiologists have had training in deaf education as well. And so I think that really prepared me to be in the university setting, and now also be in an educational role where I'm training audiologists and surgeons, and also seeing how the deaf education program at WashU has shaped Kyle's career, and also how we can now collaborate and work together, which is really amazing.
Yeah, I was wondering what your conversations were like at the dinner table. Do you guys just talk about deaf education all the time?
It's always fun. It's always fun.
always keeps it interesting. No, not all of the time, obviously, but like recently we have been talking about troubleshooting cochlear implants, and I've been able to provide some education to Kyle, as well as the educational audiologist that he works with, working with children and students with cochlear implants.
Yeah, that's great. And you guys work together in Mississippi.
We did. So in Mississippi, I was at the university in the clinic and seeing all pediatric patients. And Kyle was providing early intervention services, and he was one of very few early interventionists in the state of Mississippi. And so many of the children that he worked with were also my patients. And you know, working with an underserved population was really eye-opening, and I think really shaped both of our ideas for the future and how to serve children with hearing loss.
Yeah. How so? Like your experience in Mississippi, you said there were limited early, like just a few early interventionists. How many were there?
Yeah, so I know at the school that I worked at Magnolia Speech School as an early interventionist in the birth to 3 population, and there were 3 of us there. And then the only other area where there were listening and spoken language early intervention focused was at the Children's Center in Hattiesburg, Mississippi, which is further south. Southeast, but they only really venture out into their specific area. They don't travel across the state like the 3 of us did. So there were essentially 3 of us trying to cover an entire state, except that little bubble where Hattiesburg was, and they covered their kiddos down there. So.
And as early interventionists, do you mean that you were there were 3 early interventionists that specialized in deaf education, or there were 3 early interventionists, period? Because early interventionists can also mean OT, PT, SLP.
Yes, I'm mentioning the ones that focus specifically on deaf education.
Oh, okay. Yeah,
yes.
Got it. Just wanted to clarify. And so there was a smaller program happening for the entire state, and some that focused just on listening spoken language, and maybe some more that were focusing on sign. Okay.
Of course, you have the Mississippi School for the Deaf as well, which is ASL based. So, that wasn't far away, and there were lots of children that went there, but there were also children that came into clinic that go to school there as well. So.
And for the families that their focus was listening and spoken language, dependent upon where they lived in the state, Kyle would travel, and himself and the 2 other early interventionists would travel and do home-based therapy, and would focus on listening and spoken language. But sometimes that meant he was driving for 4 or 5 hours that day to find the home of a family, and then those families would then turn around and drive just as far to get to me in clinic, and so it was definitely just an interesting opportunity for us to work with families across the whole state.
Yeah, lots of challenges to overcome within the travel and the ruralness of the area. Yeah. We have similar things like that in Hawaii, so I understand. And I want to get into a little bit more about the services that are ideal for children who are diagnosed. So maybe from the audiology perspective, what do you see as the primary focus for a child when they're first diagnosed?
So earlier is certainly better, and I think that being married to an early interventionist also really has solidified that for me. But also from the research perspective, there's a lot of work out there right now that is showing that the earlier that we can have a child diagnosed, and if their focus is going to be listening and spoken language, getting devices on early, and then also having specialized services. And that's where, early intervention with you, Christy, and with Kyle comes into play. And so for an audiologist, it's always heartbreaking whenever a child, comes into clinic and is 3 or 4 years old and isn't talking, and the parents want to focus on listening and spoken language, and they're looking for answers, and you finally diagnose a hearing loss. And as an audiologist, you want to see that happen as early as possible so that, you can help the family reach their goals for their child, and then also help the educators help their goals, for the child in school.
Mm-hmm. Yeah, definitely. Anything to add to that, Kyle, from your perspective as an early interventionist?
Yeah, so it's extremely tough, especially Mississippi, for example. But the motivation is a key factor, and it's not that families aren't motivated. It's a lot of they don't have the education and awareness to know that it's really important to be motivated to get your child in to see an audiologist or an ENT to find out if there's something going on as early as possible. So a lot of what my colleagues and I did is we did a lot of educational awareness. So if we could, we would travel to educational buildings and talk with caseworkers and social workers and things like that. And we would do little in-service get-togethers where, we'd bring some food and we'd have like an hour of their time during like their staff meeting for a month. And we talk about just some things to look for, some things that you can talk to parents about. You should be able to give them some basic information too that can help point them in the right directions, because we're stretched thin as it is, and we can't always be where we need to be when the parents need those answers immediately. So if we can help others to talk to the parents and empower the parents and help them feel like, this isn't as hard as I feel like it might be. There's people that are actually fighting for me that care about me and want to see everything done right, that they're more motivated to do so.
Mm-hmm. Yeah, really giving them that they're not alone. And then what's one like point of advice, like if you could say one thing to families to encourage them or to help them not necessarily even understand the science around the deafness, but just to ease their mind a little bit. Either one of you have an idea of what you would tell parents?
I think that one thing that I hear most often is my child's the only one in their classroom, or they're the only one that I know with hearing loss, or they're the only one with a cochlear implant, and they're not alone. And I think that in my current position, being able to connect some families that both are in similar situations has been really helpful. So just telling them that they're not alone and that they will get through this. There is always a difficulty in the beginning of new hearing aids or cochlear implant, but it will get better. And the more that they work and the more that they participate in early intervention or educational services, the better it's going to get. Yeah.
Mm-hmm. Yeah, thanks for that. Anything from you, Kyle? Any ideas about what you tell parents?
Yeah, so parents, you can tell right off the bat, most of them feel overwhelmed.
Yeah.
And that's a lot of the reason why a lot of parents don't want to come back. A lot of parents are afraid to come back because they're afraid of what they might hear. And then they do feel like they're alone. But that's where, after what she's doing and getting them in the information, letting them know, getting a diagnosis, that's where it's our job to get in there as soon as possible and say, hey, we have some decisions that we can make. So you don't have to do one specific thing, but we have this program and we have this program, we have this program. You can make a choice. You could decide something that you'd like to do. Tell me what your goals are. So I like them to think about 5 years from now. What do you want to see your child doing? Do you want them to be in a regular classroom with typical peers and talking with them and socializing, going to birthday parties, making friends, those type of things? And that's really what they want to see. A lot of their words are, I want my child to be a normal child.
Mm-hmm.
As much as I don't like hearing that.
Right.
I don't want to say there's nothing.
What's normal?
Everyone is normal.
Mm-hmm.
There's just a different route to get to where you want to be. That's essentially what we're.
Yeah. And you have an interesting perspective growing up with a brother who was deaf. So from that, like, what was your idea? What was your perspective on like growing up with a brother who was deaf, and what were you noticing in terms of his integration into the world?
It's really interesting. So my brother lost his hearing completely at the age of 2. So he had some residual hearing, and he which weirdly enough, he contracted scarlet fever of all things.
Yeah.
And that's how he lost hearing in both ears. So he's profoundly deaf bilaterally. And he worked, because back then there weren't anywhere near the amount of resources we have today and the specialists and professionals. So, you know, they said to my mom, I remember my mom telling me this as I got older, that they wanted to send him off to a school where he could just learn to sign and things like that. And my mom's like, no, if he can talk, I want him to learn how to talk. I want him to be able to communicate with kids and talk and make friends and things like that. So he had a speech therapist that worked with him for, I think, 5-6 years, all the way through elementary school. And, you know, his speech just started to get better and better and better. And he only wore hearing aids. So he only had hearing aids, which is interesting. And still today, to this day, we give him some research. He'd be like, hey, check this out. See what it's like with the cochlear implants. See the kind of results that people get and things. He's set in his ways, though. He's like, you know, I'm fine how I am. But he went on through high school, graduated high school, went on to college, graduated college with a professional writing degree, and he loves to write. So, you know, that process for him was really interesting. But as I got older, I noticed things that he has difficulty in social situations. He doesn't know exactly how certain things are back and forth, like with talking to one another. There's some social cues that he doesn't pick up on. There's a lot of there's like little things. Difficulty with background noise, and he still wants people to see, like he likes when you're in front of him, when you talk to him. So obviously his brain hasn't been that well trained because of, you know, less amplification to be able to pick up sounds from different directions behind him and things like that. And also he's the social aspect of being out and meeting people and just exchanges that you have out in public with like a stranger. Let's say you go to a store or something like that. It might be a little bit difficult for him to understand what someone is saying because he's not used to talking to them. So it just makes it a little bit more difficult for him. So I started to notice these things as I got older. But once I went through my training at WashU, it just became very clear to me that there were a lot of things that he wasn't able to get back then that he would definitely be able to get today.
Yeah, and he grew up with hearing until he was 2. So he had a lot of language for those first 2 years. And so that's pretty amazing that he was able to get that and then move forward to kind of figure out how he wanted to live his life with the hearing loss. So, yeah. And Kaitlyn, did you say that you had a sibling also who had a hearing loss, or?
My younger sister, whenever she's 2 years younger than me, and when we were little, my mom noticed that she just wasn't talking as early as I did and wasn't talking as much as I was. And I think part of it was that I often talked for her. But my mom just felt like something was wrong. My mom's also an educator. She was a teacher and now she's a principal. And so being in education, she just noticed that something just wasn't right. And she really pushed to get my sister's hearing tested. And my sister had chronic middle ear problems. She had a lot of ear infections growing up and ended up having to have multiple middle ear surgeries, including several sets of tubes. And eventually her hearing did improve with some of the surgeries that she had, but even to this day, she still will have ear infections and still has difficulty with her ears. But I remember as a child going to the audiologist and the ear, nose, and throat doctor with her and just thinking it was so cool that she got to be in the booth and play all the games with the audiologist. And that just really made an impact on me and definitely helped drive my future career.
Yeah, now you get to direct the playing, and maybe not necessarily, but sometimes I bet you get to play in the booth too.
Yeah, absolutely.
Yeah. Oh, that's fun. It's interesting, the middle ear stuff too, because we have a lot of that in Hawaii where there's a lot of ear infections, a lot of talk of doing tubes. And the thing that is maybe misunderstood is that there's a lot of missed language during those times.
Absolutely. And that's actually what, my mother was noticing and what drove her to have my sister's hearing tested. Those first few years of life are critical for language development. And a lot of children, there's a lot of research out there that shows that children learn through incidental language learning, meaning that they're overhearing. And the more that they overhear, the more they're picking up, they're building their language. And whenever you have fluid in your ears, like an ear infection, that's blocking the transmission of that sound, and they're not able to overhear like children that don't have ear infections. And so certainly there can be a lot of missed language in those first few years with undiagnosed ear infections.
Yeah, definitely. Did you notice that it impacted your sister at all and later in life now even, or in terms of language?
It does. She says to this day that she feels like she has difficulty spelling and sounding out words, and she feels like that has always come from early on, just not having that early language acquisition. But my mom was very diligent in working with her and making sure that she was caught up and on grade level. But it certainly, I know, in the first few years of life really impacted her, and having to go back in for several sets of tubes and surgeries. I think about now that I'm counseling parents, thinking about how that impacted my mom, and how difficult that must have been for her, knowing that her daughter was going in for multiple surgeries. It's not something that I thought of growing up, but now that I'm the one counseling parents about it, it's always something that I think about.
Yeah, I'm sure. I think it's very fascinating how both of you have been shaped by growing up with this in your life, and how you've come to use it in your professional life, and now you get to really focus on it from all the different ways that you've learned. So that's really awesome. Right now, you're both working on kind of new aspects in life, and you're just moved to California. So Kaitlyn, you're now on a track of servicing more of that educational portion to audiologists in California and in Hawaii. And then Kyle, you have the degree in deaf education, and then you're also working on your LISLs. So can you tell me a little bit more about what it means to get a LISLs and what that's bringing to you in terms of your professional understanding?
Yes. So the LISLs track that I'm on is for the ABT cert. And I know I'm back in the classroom. I've gone from in-home therapy to doing early intervention to back in the classroom. But the ABT track is the one that spoke to me most, just because I come from a background of teaching. I used to be a second grade teacher before moving all the way out to St. Louis and then California. And I taught for 7 years in a second grade classroom. So I didn't have much parent involvement. I love when parents are involved in any aspect of education. So being in early intervention, parents had to be involved. There was no choice. Like, you got to help that, because the natural environment's at home. The things we work on, you got to do there. So the LISL cert is just another way that spoke to me to be able to really get through to parents and say, what I would do and work on with you, I'm not going to be your child's best teacher. You are absolutely going to be your child's best teacher, but I can help you be that best teacher. And I look to coach parents with strategies that are research-based, that are proven to work well, and implementing these strategies and coaching strategies with these parents so that they can use them at home, and not just at home, everyday life, going to the grocery store, taking your child to school, ways that your child can work on them in school, your teacher can learn about them too. So just this ABT track has allowed me to really focus on specific areas of development for me as a deaf educator that I can look at and say, I did this pretty well, but here's something I could really improve on. It really helps me to look back and self-reflect on my abilities and how I coach these parents to work with their kids.
Because the track of getting a LISLs is basically 3 years after your graduate degree. Is you work under a mentor, and you have that mentor sort of coach you through what you're doing, and you get to self-reflect and assess how you have been as a teacher, as an early interventionist, as a deaf educator. And at the end of those 3 years, you then sit for a test
Yes.
to say,
exam.
how'd you do?
Yeah. Yep.
Yeah. So the experience, like it's extra work, obviously. And it's pretty,
Sure.
pretty intensive to make sure that you do your homework and do the studies, and then you have to meet with your mentor. And how often do you have to meet with the mentor?
Yeah. So with my mentor, who actually is based in Australia,
Mm-hmm.
there's 20 videos over the course of 3 years that we have to record, and it's therapy sessions, an hour long. And we do these sessions, and then we meet sometime after we record the video. We submit our information, but not just our video. We send information like a current level of functioning, a current audiogram, short-term goals, long-term goals, a lot of different pieces that go into discussing what I did in the video. And then I'll sit down with my mentor, and we'll, through Zoom or Skype or FaceTime, whichever works best for her, we'll talk about the video, what she saw, what she really liked, some things that, she thought, why don't you try this next time, see how this works.
Mm-hmm.
It's a lot of trial and error, but it's also a lot of things because she's got 30 years of experience all over the world, that she knows what she's doing. And I want to improve. I want to learn as much as I can. So if she suggests something, I go back and I try it the next time and see how it goes. It might go better. It might not go as well. But that's the beauty of this. Like, you can go back and say, this worked really well for this family, or this didn't go so well, so maybe we could try something different.
Mm-hmm.
So we have 20 videos over 3 years, and then participation and discussions, and accruing AG Bell, continuing education, CEUs, AG Bell CEUs that we need, and then over 900 hours of therapy, things like that. There's a long laundry list of requirements that you meet. It's a lot of work, but it's very rewarding, and it's very beneficial to my profession. So I really enjoy doing it.
Yeah. Are others in your school also LISL certified AVT or AV-Ed?
Our SLP at the school, the site that I'm working at right now, she is LISL cert. She's a LISL AVT cert. So it's nice because I could kind of pick her brain too about certain things. Which is very
a nice little community. And some schools actually require their teachers to be LISL cert, like the MOOC Center in St. Louis required it, and I think CID and others, they require it. Yeah. Does your school require it?
They do not require it.
No. So it's just mostly for your own benefit.
Yes.
In your profession. Yeah. Awesome. Thank you for sharing that. And so we're about out of time. Is there anything else that either of you want to add about working with children who are deaf or hard of hearing?
I just want to thank you, Christy, for all the hard work that you're doing in Hawaii. And I think it's really amazing to see, how we all started at WashU and how we've all kind of followed our own paths, but are all still, working to better the lives of children with hearing loss. I think the work you're doing in Hawaii is really amazing.
Thank you. Yeah, I appreciate this connection. It's been super helpful to have more connection with everybody in the world who's within this profession, because I'm in the middle of the Pacific Ocean on an island, so it's pretty good.
An island.
Yeah. So thank you both. Have a lovely day.
Thank you.
Thank you for having us.
Yeah. All right. Talk to you later.
All right. Bye.
Bye.